Hello everybody, I hope this finds you well, and thank you very much for taking the time to listen to this short video from myself as Chief Exec here in NHS Lanarkshire. I'm going to talk a bit about the new variant today, run you through our current numbers around COVID, and also talk about some work we're doing around violence against women, which I would be keen to have your thoughts around. So if I start off first of all by talking about the new variant. At this stage in Lanarkshire, we've got 5 confirmed cases of the new Omicron variant, which obviously a lot of people are writing lots about and speaking lots about, and there have been new measures announced, particularly from the UK government in terms of restrictions. Most of those restrictions were already in place in Scotland, and although I understand that people will be alarmed by this new variant, because it seems to be a lot more infectious. What we don't know yet is whether those infections will translate into hospitalisations. So at the moment it's a wee bit of a waiting game, and I think we'll know more within the next week or two about whether or not those infections will translate into increased hospitalisations. So yesterday we had reported 332 new cases across NHS Lanarkshire. And in hospital at the moment we have 78 cases. Now that's the lowest number that we've seen in hospital since about the middle of October. So I'm hoping that that is going to continue to trend down. But as I said earlier, that will totally depend on what the new variant does. But that notwithstanding, I'm hoping that we're now coming out of the end of what will be the 4th wave for us here in NHS Lanarkshire. 7 patients in ICU, 2 on CPAP and 3 care home outbreaks. On the other side of the equation, we are asking people, particularly in the light of the new variant, to make sure they do get their boosters, and we will be opening up booster availability to wide sections now of the community to come forward. So just watch the messages on Facebook, social media, and of course nationally as well around that on the BBC. We've done 219,000 boosters now, and one of the most effective things you can do to protect yourself against COVID is still to get the vaccination. So if you haven't had the vaccination, or if you're due your booster, please log into NHS Inform, and it's really easy. Done it myself. It's one of the easiest websites to use. You just put in your details and you can select an appointment. So please do that and take advantage of that offer. I wanted also this week to talk a bit about violence against women. Gender-based violence has been a concern, as I'm sure you'll know, even before the pandemic, but during the pandemic, violence against women has actually increased, and we are now at the beginning of a period of 12 days where we're looking at what we can do to address violence against women, and that's culminating with an event, I think, on the 10th of December. So there's a couple of questions that you might wish to contribute to. So Anne Hain, who is our gender-based violence manager here in NHS Lanarkshire, is very keen to hear from you, as am I, and she's at anne.haine, Hayne, at lanarkshire.scot.nhs.uk. And the 2 questions that she and I would be interested in hearing from you on are, first of all, what is one big thing from the pandemic that continues to cause you concern about gender-based violence? So if there's something that you think is still really concerning you, even though we've gone through quite a lot of the pandemic now, what would that thing be? I guess when I was thinking about that question, I was still thinking about the impact really of lockdown on women and the inability of women to really get out of the house, and particularly if partners weren't going to work, and how difficult that must have been. And secondly, one big challenge or issue that could be best addressed through collective work across agencies. That's the second one. So if anybody's got thoughts on either of these 2 questions, we'd be really keen to hear from you, and I will contribute to that debate on Friday. So if you can pop them in an email between now and then to me, that will really help. Thanks very much.